Welcome to another video. This video is regarding red flags. Red flags are signs and symptoms found in patients' history and clinical examination that may tie to a disorder to a serious pathology. First one is trauma. A history of minor or major trauma, maybe a motor vehicle accident or a fall. Even if the trauma is minor or major, there is always a chance for fracture. A past or present history of any type of cancer may be associated with a tumor on kidney or a thyroid tumor, prostate, breast or lungs cancer. Unexpected weight loss within 3 months, like more than 10 pounds, may be an indication of infection or a type of cancer. It should be taken care that it should not be related to any kind of activity or diet plans. A recent infection, especially urinary tract infection, can increase the chance of a second infection. Immunosuppression resulting from a transplant, intravenous drug abuse, or prolonged use of steroid. In this case also, the chance of infection is very high. Generalized body pain followed by continuous work or a prolonged journey is common, but if the pain is not relieved with rest or awakens a patient at night unrelated to the movement or positioning, this increases the risk of cancer, infection, or a kind of abdominal aortic aneurysm. Urinary retention or changes in frequency of urination or incontinence may be an indication of infection or Coda equina syndrome. Progressive or severe neurological deficit in the lower extremity may be an indication of Coda equina syndrome or maybe a spinal cord stenosis. If a patient is more than 50 years of age, there is a chance for osteoporosis and a followed fracture. Seizures or convulsions, especially if they are prolonged or accompanied by loss of consciousness, this could be a sign of neurological emergency, such as a brain hemorrhage. Difficulty in breathing or shortness of breath, especially if it is sudden or accompanied by chest pain, this could be a sign of pulmonary embolism or other respiratory emergencies. Sudden severe headache or confusion, especially if it is accompanied by visual changes or weakness on one side of the body, this could be a sign of a stroke. Severe abdominal pain or bloating, especially if it is accompanied by fever, vomiting, or bloody stools, this could be a sign of gastrointestinal emergency, such as a perforated ulcer or a bowel obstruction. Chest pain accompanied by shortness of breath, dizziness, or sweating may be a sign of heart attack or other cardiovascular events. Severe or persistent vomiting or diarrhea accompanied by dehydration, abdominal pain, or blood in the stool may be a sign of food infection, poisoning, or inflammatory bowel disease. Severe or persistent headache, especially if accompanied by nausea, vomiting, or sensitivity of light or sound, this could be a sign of migraine or a brain tumor or maybe other neurological conditions. Severe or persistent back pain, especially if accompanied by weakness, numbness, or tingling sensation in the legs, may be a sign of herniated disc or a spinal cord injury or maybe other nerve conditions. Rapid or irregular heartbeat accompanied by chest pain, dizziness, fainting may be a sign of arrhythmia or heart failure or any kind of cardiovascular emergencies. Severe or persistent joint pain, especially in the peripheral joints, swelling and fever, rashes, or difficulty to move, may be a sign of rheumatoid arthritis or lupus or autoimmune inflammatory conditions. High fever or fever that lasts for several days, especially if accompanied by chills, sweats, or fatigue, may be a sign of serious infection such as sepsis, meningitis, or COVID 19. A sudden change in vision, accompanied by eye pain or redness, may be a sign of retinal detachment, glaucoma, or other eye conditions. Severe or persistent neck pain or stiffness, especially if it is accompanied by a fever or headache, may be a sign of meningitis or other neurological disorders. If a patient presents with suicidal thoughts or behavior, especially if the patient is having a history of depression, bipolar disorder, or other mental condition, this could indicate an urgent need of mental health support and intervention. Thanks for watching this video. I hope I have explained most of the red flags we face as a healthcare professionals. I'll be soon back with another video, so please keep watching. Thank you.